Hello, Nurse Alyssa here. Today we're going to discuss Biatain. So we're going to discuss the non-adhesive, adhesive, and soft hold products. But first, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. Biatain is a polyurethane foam dressing with a semi-permeable backing that is waterproof and provides a bacterial barrier. It may be used as a primary or secondary dressing. Biatain is designed to fully conform to a wound with depths up to 2 centimeters to ensure no dead space. Biatain non-adhesive is comprised from foam only with no adhesive properties. Biatain adhesive has a hydrocolloid adhesive border and backing. Biatain soft hold has a slightly adherent layer that keeps the dressing in place while a secondary dressing or compression therapy is applied. Biatain non-adhesive and soft hold can be cut to shape and needs to be secured. So indications for use. So this can be used on wounds from 1+ to 4+ amounts of exudate. It may be used under compression therapy. Biatain non-adhesive is great for fragile skin. So as people age, their skin tends to get thinner. So it is really great for fragile skin. The Biatain adhesive and non-adhesive may be used for donor sites. And the non-adhesive is preferred for diabetic foot ulcers. Just for some precautions, we can use this on wounds that are infected as long as they are being treated. The infection is being treated. We're going to remove the Biatain adhesive prior to any x-rays or ultrasound treatment. Some contraindications, so we cannot use this with oxidizing agents. So this is such as hydrogen peroxide. And we do not want to use this soft hold on donor sites. So application of Biatain, you're going to want to select a dressing that can cover the wound plus 2 centimeters overlap of the peri-wound, because you do want it on top of the peri-wound and not just on the wound. So you need an overlap by at least 2 centimeters. Then we're going to irrigate the wound and peri-wound, making sure it's free of any debris. And if required, you're going to use a barrier film around the peri-wound. So as shown here on the screen, this is the Biatain non-adhesive. So you can cut this dressing, just make sure that you have that 2 centimeters overlap. You're going to position the dressing on the wound with the plain side down, writing side up. And then you're going to secure it with tape or cling. So here you can see the Biatain non-adhesive, and here's the size of the wound off to the right hand side. So you would actually be able to cut this in 4, so you'd be able to use it 4 separate times. So if the patient is paying for the supplies, it would keep down the cost a little bit. Now we have the Biatain soft hold. So this does have a protective layer on the back where there is no writing. So that's the part that would actually go against the wound. So you would remove that protective layering and apply it printed side up and secure it with tape or cling. And this can be used under compression. Now we have the Biatain adhesive. So this is like the hydrocolloid dressing. So we're going to warm it in our hands because heat does help it stick. You're going to remove the top layer, so the protective covering, and you're going to place it on the wound. And so there's still 2 handles on the side. So you're going to place it over the wound and then remove the handles. And then slowly work your way out, just pressing it down, holding it down for about a minute. So this is the Biatain adhesive for sacral. So it's your coccyx area. So a lot of times elderly do get pressure sores on their bum. because they are sitting so much, either in a wheelchair, in their chairs, even laying in bed all the time. So once again, we're going to warm this dressing in our hands because that's what helps it stick. You're going to remove the center film and using the handles to apply it, and we're using the narrow end down, and we're going to cover as much of the wound that we possibly can, getting that as far down as you can on their bum. So then you're going to remove the handles and smooth it out, working it outwards, and then it will be applied to that area. You might want to hold your hand on it for about a minute just to make sure it sticks really well. Now we have the Biatain adhesive for your heel. So like any of the adhesive dressings, we're going to warm with our hands, and we're going to remove the top layer of the protective covering, okay? Now you can see right here, I have drawn a line right here. So we're gonna fold it like a 90-degree angle. So that's going to cup the heel, okay? So you can see that it's shaped as almost like an arrowhead. So the arrowhead piece here is going to go in the arch, and the end of the arrow is going to go at the heel. Okay, so it's going to kind of cup the foot like that. And then you're going to remove the back covering from one side at a time, kind of conforming it over, and then you take the other protective covering off the other side, and you will bring that one up to go around the heel. So to remove the Biatain dressings, first we're going to start with the non-adhesive and soft hold. So we're just going to gently remove the tape and the cling, lifting from one corner to remove the dressing. Next we have the adhesive. So this one we're going to lift up the borders first before lifting away the actual dressing. And then we have the sacral, so this is for the coccyx region. So we're going to lift up the edge at the top and pull it towards the anus. So the frequency of the dressing change is going to depend on the amount of exudate coming out of the wound. So we're going to change it when the exudate reaches about 1 centimeter from the edge of the foam, or as often as ordered. It can stay in place for up to 7 days though. The expected outcome for the Biatain dressings is that the exudate is managed without peri-wound skin maceration. So that's what we're trying to obtain. That's our goal, is to not have any peri-wound maceration, and the exudate is managed well. So that's all I have for this video. I will catch you next time.